Hi everyone, it's Crystal Lim, and I'm going to be discussing ARDS and what it is and who's more susceptible to getting this disorder. So ARDS is an acute respiratory distress syndrome, commonly known as ARDS, or some people have referred to it as the wet lung. This is a very serious and rapid disorder of the lungs. ARDS represents a spectrum of acute lung inflammation and diffuse alveolar capillary injury. It causes fluid to leak into the lungs, making it difficult to get oxygen into the bloodstream, leading to not enough oxygen being delivered to the body and the organs that need it. This can lead to organ failure. So when we breathe air in, it travels down our lungs, and in our lungs we have little sacs at the end of the tubules in the lungs called alveoli. And this is where the gas exchange happens. Oxygen is transported to the body from the air we breathe. Capillaries, which are small blood vessels in these little sacs, help transport oxygen to the blood. With ARDS, these little sacs fill up with fluid and can pop. When these sacs pop, they are no longer functioning and can no longer contribute to getting oxygen into the blood stream to fuel the rest of the body. These sacs also help get rid of extra carbon dioxide, and when they pop, they can no longer assist in that. Because of this, breathing becomes very difficult and exhausting. With less oxygen traveling to the rest of the body, vital organs can begin to fail. ARDS is very serious if not treated, because if you don't get enough oxygen to your brain and your heart, they'll stop working, and that can lead to death. And there are three phases of ARDS: inflammatory phase, proliferative phase, and the fibrotic phase. There are many things that can cause ARDS, but in most cases it's caused from some type of infection to the lung, like the flu or severe pneumonia, and now, as we've seen, COVID-19. ARDS usually follows a major illness or injury, like I said, and most people who are affected are already hospitalized. Other things that can cause ARDS are complications from a routine surgery, a blood transfusion, a blood clot in the lung, accidentally inhaling chemicals, accidentally inhaling vomit or food, acute pancreatitis. That inflammation and infection can spread to the lungs, giving birth, inhaling smoke from a house fire, near drowning, low blood pressure due to shock, overdose from some drugs such as heroin, methadone, or aspirin, seizure, or stroke. So all these things can cause injury to the lung and increase inflammation of the lung tissue, putting you into ARDS. The symptoms of ARDS are severe shortness of breath, labored and usually rapid breathing, low blood pressure, confusion, extreme tiredness, blue lips. And most of the time, like I said, these people who develop ARDS are already in the hospital. And according to the Lung Association, there are also risk factors that contribute to who will be more likely to develop ARDS. If you're already in the hospital, like I said, especially for sepsis, a widespread infection in your bloodstream, you're a higher chance of developing ARDS. If you have any underlying chronic lung conditions, if you're a smoker, if you're obese, if you're of advanced age, if you use oxygen at home for any other lung condition, if you've had a recent high-risk surgery or chemotherapy, you're at greater risk for developing ARDS. People who have a history of chronic alcoholism are at higher risk of developing ARDS. They're also more likely to die from it, and some studies indicate that the risk of life-threatening complications could be linked to race or ethnicity. The Mayo Clinic suggests that African Americans and Hispanics who develop ARDS are less likely to survive than whites. Research also indicates that men with ARDS are more likely than women to develop life-threatening problems. If you have ARDS, you can also develop other complications such as blood clots, collapsed lungs, scarring of the lung tissue, or fibrosis. This could lead to lifelong lung issues and breathing. Treatment for ARDS needs to be started promptly. The main goal of the treatment is to get oxygen to the rest of the body by improving the oxygen levels in your blood, adding supplemental oxygen by nasal cannula or mask, or being placed on a mechanical ventilator if that does not help, is going to be needed. The ventilator is going to help push air into the lungs and force fluid out of those sacs. Fluid management is also important. You don't want too much fluid or you can overload your heart and your lungs, but you don't want too little because you need to stay hydrated, and you also can overwork the heart. Medications will be given such as antibiotics to treat the infection, blood thinners to prevent blood clots, pain medication and sedation if needed, if you're on that ventilator, and sometimes anti-reflux medication to help with any occurring reflux so you don't aspirate on that again. And according to a recent article on the MSD manual, it states that without prompt treatment, many people who have ARDS will not survive. However, with appropriate treatment and quick treatment, 60 to 75% of people will survive. People who responded promptly to the treatment usually recover completely with few or no long-term abnormalities, and those whose treatment involved a long period on the ventilator are more likely to develop lung scarring. Successful treatment usually depends on treating the underlying disorder. And with COVID-19 and Ards, I've researched some articles that suggested that the onset time of COVID-19 was related Ards was 8 to 12 days, which was the longer onset of 1 to 3 days for normal Ards. So that was a little bit different. And most common respiratory symptom of COVID-19 is a dry cough and a decreased sputum. And it's suggested that this is causing injury to the alveolar epithelial cells and was the main cause of Ards in COVID-19. So with this ongoing pandemic, we need to make sure we're aware of complications of it and know what to treat Ards with. So thank you so much. References that I've used was Medical News Today article, a critical care article called Acute Respiratory Failure, Ards Symptoms and Causes from the Mayo Clinic, and our text from Pathophysiology, Acute Respiratory Distress Syndrome from the MSD Manual, and the American Lung Association. So thank you so much. Hope this helps.